Unless the patient is extremely ill, I usually don't start the patient on insulin immediately when we first discover the patient to have type 2 diabetes. Especially if the patient is stable and otherwise without symptoms, I usually start a regimen of oral medications along with diet and exercise, which we discussed previously. If the patient's glucose is significantly higher, above 150 fasting, I usually start them on oral medications such as metformin. There are different kinds of medications that do different things. For example, some medications reduce the ability of your body to stop extracting stores of glucose from your liver. Our liver stores an enormous amount of glucose. This storage is there for emergencies, and at times when the body's disruption in the metabolism, the storages are there available for the body. Some of the medications used in diabetes limit the ability of the liver to release the glucose, thereby lowering the blood sugar. Some medications also enhance the sensitivity of our own natural insulin. So in type 2 diabetes, even if the insulin is defective or not sensitive, these medications help your body respond to that defective insulin in a better way. Some oral medications basically squeeze out in a more efficient way the little insulin that your body might already have, and so the pancreas is able to function better. Some medications reduce the ability of your intestine to absorb sugar or glucose into our digestive system, in from our digestive system, thereby reducing your overall glucose levels. So there are basically several medications that are available, each in its own class, with different functions and different ways that they reduce the overall glucose in your blood. These medications, as I said, reduce the liver storage from being depleted. They enhance the production of insulin from your pancreas, or they reduce the absorption of glucose or sugars from your intestine. Among these medications noted, metformin is one that we usually start with. We have the longest history of using this medication, and its safety is very good. There's also a class called sulfonylureas, like glucotrol or micronase, glipizide, glyburide. These medications enhance the ability of the pancreas to produce insulin more efficiently. There are also the thioglitazone classes like Actos. Actos enhances or makes the insulin that you do have perform better.